Hi, today I'll discuss about a very important topic, that is preventive health checkup. So why do we have to go through these health checkups every year? So there are plenty of reasons. So we'll start with a simple test like blood counts. So if you check your blood counts, then you will have a clue about your hemoglobin level or even your vitamin levels, like vitamin deficiency of B12 or some other vitamins can get reflected in your blood counts, and then even the causes regarding the anemia also can be found. So sometimes what happens is some people might be having malignancy as well, that is cancer as well, which can be found out with a simple blood test like complete blood picture or peripheral smear. So this is just an example. So if you go ahead and talk about the sugar test that we do, that is fasting sugar and the postprandial sugar along with the HbA1c, which is an average of your sugar level in past 3 months. So that gives a clear-cut picture about your sugar levels and diabetes, whether you are prone to diabetes or whether you have already been diagnosed with diabetes or you're affected with diabetes. So it gives a clear-cut indication whether we start the treatment or whether you should be put on diet modification and exercise. So that's just another example. And sometimes what happens is if we check your renal function test and liver function test, then we get more clues. For example, you might be having jaundice, which you are not even aware of. For example, like you might be having sickle cell disease, because of which you are getting jaundice every now and then. Or you might be having a congenital disorder like Gilbert syndrome. So there are plenty of examples which can be detected only if you go through a preventive health checkup. Likewise, if you have a kidney issue which you are not aware of, then that can be found out with a simple test of renal function test. So these are just a few examples that we have to do or we do regularly with health checkups. And then if we go ahead and do cholesterol levels, then we can find out if you're having increased cholesterols like total cholesterol or low density lipoprotein. So these two, if elevated, can lead to heart diseases. So if you're already having high levels, then we suggest you have diet modification or start treatment to prevent heart disease or heart attacks. And some people might be having a family history of high cholesterol. So in such case, we have to start them on not just single medication, but even 2 medications if required for cholesterol lowering. And then if we do a scan, a simple scan like ultrasound abdomen, then we can find out plenty of things, like if your liver is increased because of the alcohol that you might be taking, or if your spleen is in correct condition or not, or if you have any abscess in your liver or spleen, or if you're having any gynec related issues or kidney related issues like any kidney stones, or even kidney size is reduced, or if you have any enlargement in the kidney. So all these can be found out with simple investigation like ultrasound abdomen. Likewise, if we go ahead and talk about the 2D echo scan, that is heart scan. In that scan, we can find out if your heart has normal chambers or not, if there is any dilatation or enlargement of the heart, or if there is any fluid around the membrane of the heart, or if any other problematic things like valve disturbances or any thrombus or an accumulation in the heart valve which is not normal. So all these things can be found out with a simple heart scan. And if you are found out to have any abnormalities, so that you can start early management, that is in terms of treatment like medical management or surgical if required. So it is always advisable to go through health checkups at least once in every year. So when do we have to start these health checkups? So typically recommended at the age of 30 years. Every year having a health checkup is best for you so that you can be diagnosed with any diseases in the very early stage, so that you can be started treatment accordingly and you can have a very healthy life. Thank you.